This is 32. Looks like we're in mucosa because we have epithelium with no granular layer, no stratum corneum, and no adnexal structure. So we're in the mucosa, and they wanted a pigmented spot, and look what we found. There's little stippled black pigment here. Some areas it actually starts to look more brown because it's very fine and delicate, but actually in other areas it looks more like black. And here it's actually like embedded, it's laid down on like little wispy fibers of probably elastic fibers are picking up the pigment. Some of it's little specks, some of it maybe is getting ingested in macrophages, histiocytes. And this is probably in the oral cavity. So do you know what this is? Something we don't see very often. Yeah, amalgam tattoo, the metal from the amalgam that you got when they were using the drill or whatever, it got flicked and spun away and embedded into the adjacent tissue, or maybe some of it I don't know exactly how it gets in there. I'd always heard that it was from the high speed uh, devices they were using that some of it got spun down into the tissue, but I'm not a dentist and I don't know if that's accurate. In any case, sometimes you can see little grayish brown, grayish black spots in the gums of people that had like metal amalgam used for fillings or caps or dental work. I know there's been a tendency in recent years, I think, to use less of the metal and more of other types of composite materials. But again, I'm not a dentist, so we rarely, in my practice, rarely encounter this. But these are little metal particles. So another thing that can cause little tiny, very subtle black speckly particles is silver, argyria. Again, we usually see that from people who drink colloidal silver, but silver miners could also get this, but we don't see a lot of silver miners in our geographic area. So other types of metal, gold, which again is rarely seen nowadays, but from gold-containing drugs like that used to be used to treat rheumatoid arthritis and other things. So any sort of metal particle deposition will give little black specks, and sometimes it can be extremely, extremely subtle. This case is abundant here, but like argyria is very, very subtle and hard to diagnose microscopically.